Welcome back to Prime Senior Living, where we explore timeless secrets for health, longevity, and vitality for your golden years. Today, we uncover a fascinating hidden connection between your hands and your heart, inspired by the wisdom of two legendary doctors. Dr. Howard Tucker, a renowned neurologist, has spent his life understanding how our nervous system regulates our most vital functions. Alongside him is the philosophy of Dr. Shigeaki Hinohara, who believed in simple, natural habits to maintain health well past 100. High blood pressure is a silent challenge that affects millions, forcing the heart to work harder than it ever should. As we age, our blood vessels naturally stiffen, creating resistance that drives up pressure and puts our health at significant risk. But what if the key to managing this pressure was literally in the palm of your hand, waiting to be unlocked? These doctors discovered that specific hand movements can trigger a biological reset button for your entire cardiovascular system naturally. To understand this, we must look beneath the skin at a sophisticated network of vessels known as the palmar arch. The palmar arch is a crucial intersection where arteries meet, acting as a remote control for blood flow in your arms. Embedded within this vascular network are tiny sensors called mechanoreceptors, which are incredibly sensitive to stretching and physical pressure changes. When you stretch your hand correctly, these receptors send an immediate, direct signal up your arm and into your brainstem. This signal tells your brain to lower the sympathetic tone, effectively instructing your blood vessels to relax and widen immediately. Think of it as turning a dial that opens up your internal pipes, allowing blood to flow freely without high pressure. Dr. Tucker emphasizes that this is not magic, but pure physiology, utilizing the body's built-in reflexes to maintain balance. After the age of 60, the arteries in our extremities, especially the hands, tend to harden faster than elsewhere. This hardening creates a back pressure that forces your heart to pump with excessive force just to circulate blood to your fingertips. By ignoring this stiffness in the hands, we unknowingly increase the workload on our heart with every single beat it takes. However, by manually stretching these tissues, we can restore elasticity and signal the body to reduce this peripheral resistance. Dr. Hinohara practiced similar techniques daily, believing that flexibility in the body leads to flexibility in the blood vessels. The technique is simple, requires no equipment, and can be done anywhere. But precision is key to getting results. We will now guide you through the exact method, step by step, to ensure you activate the palmar arch correctly. Start by finding a comfortable seated position. Keep your spine straight and your shoulders relaxed to allow optimal blood flow. Extend one arm directly in front of you. It is vital that you do not lock your elbow. Keep it soft. Locking the elbow can restrict circulation, so maintain a gentle bend to ensure the stretch focuses on the hand muscles. Rotate your wrist so your palm faces forward, as if you are signaling someone to stop, with fingers pointing up. Now, open your palm and spread your fingers as wide as possible. Imagine you are trying to span a large object. Pay special attention to your thumb. Stretching the thumb away from the index finger is crucial for opening the radial artery. The thumb acts as a gateway for the radial artery, and stretching it fully maximizes the signal sent to your brain. Hold this maximum expansion for exactly 5 seconds. You should feel a pleasant stretch across the skin of your palm. Now, use your other hand to gently pull the fingers back towards you, increasing the stretch deep into the wrist. Apply gentle pressure. You are not trying to cause pain, but simply to deepen the activation of the palmar arch. Hold this assisted stretch for 3 seconds. Breathe out slowly as you do this to encourage your muscles to relax. Release the pressure and slowly, very deliberately, curl your fingers inward to form a loose, comfortable fist. Do not squeeze tight. This is a loose fist, meant to relax the tissues you just stretched, not to tense them. Hold this soft fist for 3 seconds. This phase allows the blood to refill the vessels in a controlled manner. Open your hand and repeat the entire cycle. You should aim for 6 to 8 repetitions for each hand per session. The entire process takes only about 1 minute per hand. It is a small investment of time for a massive benefit. Studies suggest that this simple mechanical action can help lower systolic pressure by relaxing the systemic vascular resistance. Timing is everything. Dr. Hinohara suggested doing this 3 times a day, starting immediately when you wake up in the morning. Morning is critical because your blood pressure naturally spikes when you wake up, a phenomenon known as the morning surge. By stretching your hands first thing, you signal your body to moderate this surge and start the day calmly. The second key time is late afternoon. This is when fatigue sets in and blood pressure often creeps up again. Performing the technique now acts as a bridge, transitioning your body from the stress of the day into evening relaxation. Finally, practice this right before bed. This is the most important session for improving your sleep quality and recovery. This evening session activates the parasympathetic nervous system, preparing your body for a deep, restorative, and heart-healthy sleep. However, there are common mistakes you must avoid. Never pull your fingers to the point of pain or discomfort. Force is not the goal. The goal is stimulation. Too much force triggers a stress response, which raises blood pressure. Do not hold your breath while stretching, as this increases internal pressure and counteracts the relaxing benefits for your blood vessels. Breathe deeply and rhythmically throughout the exercise. Oxygen flow is essential for the signaling process to work effectively. Do not forget the thumb. Leaving the thumb close to the hand ignores the radial artery, reducing the technique's effectiveness significantly. Watch the difference. On the left is tension and stress. On the right is fluidity, relaxation, and true healing. Both Dr. Tucker and Dr. Hinohara understood that small, consistent habits are the foundation of a long and healthy life. This technique is not a replacement for medication, but a powerful natural companion to your existing medical treatment plan. Consistency is the secret. Doing this sporadically will not yield results. Make it a non-negotiable part of your daily routine. Share this knowledge with your friends. Doing these exercises together can create a community of health and mutual support. Let's recap quickly. Extend the arm, spread the fingers wide, gently pull back, and release into a soft fist. Your hands are the tools that built your life, and now they can be the tools that save it. Embrace this simple practice. It costs nothing, takes only minutes, and offers a profound connection to your body's wisdom. If you found this video helpful, please like and subscribe to Prime Senior Living for more evidence-based health guides. Take care of your heart, and it will take care of you. Thank you for watching, and see you next time. Let us delve deeper into why Dr. Tucker considers the nervous system the master controller of our cardiovascular health. The autonomic nervous system is a delicate balance. Stress tips the scale towards the sympathetic side, raising blood pressure. Chronic stress keeps us in a state of fight or flight, causing our blood vessels to remain constantly constricted. The hand stretch, which acts as a manual override switch, forcing the body to acknowledge that it is safe to relax. Dr. Hinohara's longevity was not just about genetics. It was about the cumulative effect of small positive daily choices. Just as water shapes stone over time, these gentle exercises reshape the responsiveness of your arteries with consistent practice. Medical data consistently shows that lifestyle interventions can be as powerful as pharmaceuticals in the long-term management of hypertension. This technique is safe for all ages. Teaching it to your family ensures that everyone understands the value of prevention. The thumb has a massive representation in the human brain. Stimulating it provides a disproportionately large benefit to your nervous system. In neurology, we know the hand occupies a huge area of the brain. Moving it consciously activates significant neural pathways. Perform the movements with mindfulness. Focus your mind entirely on the sensation of the stretch and the blood flowing. Visualization amplifies the effect. Imagine the tension leaving your body through your fingertips as you exhale and release. For those still working, this is the perfect desk exercise to combat the stiffness that comes from prolonged computer use. A quick safety note. Please do not perform these exercises while driving. You need your full attention on the road. The best place is a quiet spot where you can sit safely and close your eyes for a moment. Think of this not as a replacement, but as a partner to your medication. They work together for your health. Over time, with consistent practice and doctor supervision, some patients find they can reduce their reliance on higher dosages. Unlike stress balls, which involve squeezing and tension, this technique focuses us on opening, expanding, and releasing the stored tension. Squeezing can momentarily raise blood pressure. Stretching does the opposite by creating space and inviting blood to flow in. This is why the loose fist step is so critical. It is a moment of rest, not a moment of effort. We want to encourage laminar flow in your arteries' smooth, streamlined movement of blood without turbulence or high pressure points. Let's reinforce the schedule: morning to blunt the surge, afternoon to reset stress, and evening to prepare for sleep. Set an alarm on your phone right now. Call it your heart health time. Make it a priority in your day. If you ever feel dizzy or unwell during the exercises, stop immediately and sit down. Listen to your body's signals. Always consult your physician before starting any new exercise routine, especially if you have existing heart conditions or concerns. Hydration is also a partner to this exercise. Drinking water helps maintain proper blood viscosity, making circulation easier. Observe your hands after the exercise. They should feel warmer and look rosier, a visible sign of improved circulation. This warmth is the physical proof that the arteries have dilated and warm blood is reaching your furthest extremities. Dr. Tucker teaches that the body is an interconnected machine. We cannot treat the heart without considering the extremities. Your circulation is a closed loop. Improving flow in the hands reduces the resistance the heart faces from the periphery. Combine this with gentle walking. When you walk, keep your hands loose. Don't clench fists, as that raises pressure. Nutrition plays a role too. Low sodium intake combined with these exercises creates a formidable defense against high blood pressure. Reduce salt, increase movement, and practice your hand stretches. It is a triad of health that costs absolutely nothing. Deep breathing amplifies the benefits. It stimulates the vagus nerve, which works in harmony with the hand reflex. The vagus nerve is the superhighway of relaxation. Hand stretching and breathing are the keys to unlocking its power. Treat this exercise time as a mini meditation. A few minutes of peace in a chaotic world is vital medicine. Do not expect miracles overnight, but give it 2 weeks of consistent practice and you will likely feel the difference. Commit to a 2-week challenge. Track your blood pressure numbers daily to see the objective proof of your progress. Seeing those numbers drop, even by a few points, gives you control and confidence over your own health journey. Lower blood pressure means more energy, less fatigue, and the freedom to enjoy the activities you love with passion. Dr. Hinohara always took the stairs and carried his own bags. He believed in using the body to preserve it. Your hands are made for connection. Keep them strong, flexible, and healthy so you can hold on to what matters. Remember the 4 steps. Extend the arm, spread the fingers, pull back gently, and release into a soft fist. Master this flow. Make it as natural as brushing your teeth. Your heart will thank you for every single repetition. Listen to your body. It is constantly speaking to you. This exercise is a way to answer back with kindness. At Prime Senior Living, we believe your golden years should be your best years, filled with health and vitality. Check out our other videos on circulation and nutrition to build a complete lifestyle plan for your cardiovascular wellness. Don't keep this secret to yourself. Share this video with a loved one who might be struggling with blood pressure. Try the exercise right now and tell us in the comments below, did you feel the warmth in your hands? We appreciate your time and trust. We are honored to be a part of your journey toward better health. Remember to subscribe and hit the notification bell so you never miss a life-changing update from Prime Senior Living. From all of us here, wishing you a happy heart and a long, healthy life. Goodbye and see you soon.